in the pediatric psychology department and in the comprehensive pediatric feeding program at Nationwide Children's Hospital. He graduated with a bachelor's degree in psychology from Miami University of Ohio, then earned a master's and doctoral degrees from Michigan State University. He continued his training at Allegheny General Hospital and the Children's Institute Rehabilitation Hospital in Pittsburgh, Pennsylvania, followed by a fellowship in pediatric psychology at Akron Children's Hospital. He has currently a faculty appointment as a clinical assistant professor of pediatrics in the Ohio State University College of Medicine. His primary clinical and research interests are in feeding disorders, behavioral change, motivation, and learning strategies for children, and he works clinically with this population as well as other children with functional gastrointestinal problems such as rumination syndrome and short gut. He also has a passion for improving teamwork and team dynamics within multidisciplinary health care teams. We are thrilled to have him, and I know this is a very popular topic, so thank you very much for being here, and we look forward to hearing from you.
Hello. Hello. Am I on with this one? I am on with this one. Okay. Well, thank you guys so much for being here. And first of all, on that last slide, I want to really, truly thank whoever gave me an honorary MD, because I did not go to medical school, but I love that MD before my PhD. That would be really fantastic. So thanks to whoever gave me that. So I hear that this is a popular topic amongst the parents in the room today. And so I'm happy to be here to talk about it with you all. In general, I do behavioral intervention all day, every day in the feeding clinic. And so what I'm going to be talking to you about today is primarily some of the strategies that we as psychologists use to try and change behavior or modify behavior, teach more functional skills, all of that. And so I'll be talking about some of the general foundations after I identify myself, and as I've learned today, which I love that term. So first of all, as they introduced, I am a pediatric psychologist. What that means is that I'm a psychologist who happens to specialize in working with kids with chronic medical or developmental disabilities. And so that's what I spend my days doing. And one of the reasons I put up this, this middle sentence here is just to let you guys know why I'm so thrilled to be down here, and why I'm so excited that I got invited, is that I kind of live my life and do my work in order to remove barriers so that people and groups can reach their full potential. And I think that really applies to the kids that I work with, is that many of them have barriers put in front of them that are congenital or acquired, and I feel like my job is to try and remove as many of those as possible so that they can flourish and develop and live the best life possible. So, and then, as they said, one of my primary interests is in team dynamics and process improvement too. So, sorry, the mic needs to be up here. So you might see some of that in my discussion of teamwork and things like that in the treatment of these children. So I'm going to discuss the general theory. I'm going to talk about some specific intervention techniques and identify how you might use those as potential strategies, give some examples, and then, like I said, modifications for special population. And then my plan is to leave lots of time for questions at the end. So I'm going to try and get through the information so that we can just talk and you can ask me what you have. So let's start at the beginning. Behavior learning theory is a theory that posits new skills and behavior are acquired through experience and conditioning. Now, this is kind of a loaded assumption because there are other theories of learning out there. So I want to make it clear, this is just the theory that drives behavioral psychology, is that we're kind of blank slates when we come into the world other than our genetics, and that the environment shapes the things that we learn how to do, the behaviors that we have, communication styles and things like that. They point to things like culturally determined behavior as an example of how that might play out in real life. And so there are two types of conditioning that we would assume operate on learning of behavior and how kids are going to behave. One would be classical conditioning. That's your Pavlov's dogs. So you're associating two things with each other. Bell rings, food comes, bell rings, food comes, bell rings, food comes, and then all of a sudden the bell rings and the dog is already salivating like the food is right in front of them. They've just paired the two things in their mind. So in humans, it's I do a behavior, something happens, do a behavior, something happens, and then I just associate that behavior with what comes after it. So operant conditioning, on the other hand, is when we add purposeful reinforcement. Reinforcement is designed to steer behavior one way or the other. And so I'll talk about how reinforcement might apply to behavior change in a little while. But operant conditioning is the idea that we are purposefully trying to teach someone to do something different or to replicate a behavior over and over again. Okay? So in the beginning, we want to do, if we're looking at a behavior, we're looking at something we want to change, most parents come to my office and they can very, very easily identify what the problem is. It doesn't take a lot of experience, and I don't have to ask too many questions, just why are you here to see me today? And usually they will have a whole slew of issues going on that we need to work on. So that's the problem that's at hand. And in a functional behavior analysis, we call it the ABCs. You would start off with what's the antecedent or the trigger. This means what's happening right before the behavior. So in the example of, let's say, a tantrum, what's happening right before the tantrum? Is it time for bed? Is it time to put your shoes on? Is it time to transition from one activity to another? Is it mealtime? Usually there's something that precipitates the behavior happening. The word no is my favorite trigger. That's a pretty common one. And then the behavior happens. And then right after that, there's a consequence or an outcome of the behavior. And that's the environmental component of things. So the consequence might be for a tantrum that they get handed a comfort item, or they get moved to a different room, or they get down from the table during a meal because the rest of the family still has to finish. So the consequences don't necessarily have a direction, but these are the two broad categories and some subtypes of consequences that we as psychologists think of. So if you're in a therapy with a psychologist, you'll be talking a lot about these things. I hope you can read them a little bit, and you'll be able to have these slides online. But in the top left, reinforcement is anything that is designed to increase the likelihood of a behavior occurring again. Best example I can give for us as adults is a paycheck at work. We go to work, we do some work, we get a paycheck. That's designed to keep us coming back to work. If they stop giving us a paycheck, I, for one, well, I love my job, so I'm a bad example, but most of us would just stop going to work. You lose the motivation that you had to do that behavior. And so we try and always apply reinforcement to positive behaviors when we're looking to get something to change in the end. And on the other side, punishment, designed to decrease the likelihood of a behavior happening again. We think about common types of punishments, and there's both positive and negative. It doesn't necessarily mean good or bad. Positive means you're doing something after a behavior occurs to try and decrease that behavior again. Old school example is a spanking. So you do something bad, I do something bad to you. The design is you're not going to do that as much anymore. A negative punishment is much more popular these days. We call it a penalty. That's something, you remove something positive in response to a bad behavior. So you do something bad, I take your iPad, the favorite one these days, or I take the phone away, or I take your favorite toy, or I put you in a corner. So those are both types of consequences that are designed to decrease a problematic behavior happening again, okay? Now, on the other side, for reinforcement, positive reinforcement is what we're all probably very familiar with. You do something good, I give you something good. The role there is we want this to continue happening. I give you praise or I offer you a reward, and you should probably do that behavior more often. And we all learn like that in our lives. When we get positive feedback from one of our friends or family members, we're probably likely to do something that we've just done again. Negative reinforcement, though, is why I make my money. It's the most complicated, and it's what gets us as parents into trouble all the time. Negative reinforcement, put another way, is called escape. And that's where something negative is removed in response to a behavior. Just because it's in response to a behavior doesn't mean it's in response to a good behavior. So the best example that I have from the feeding world is parents are offering food, the kid throws a tantrum, and then they get to escape and leave the table. And so unwittingly and reasonably, parents are negatively reinforcing that escape behavior that they're having, the tantrum, the spitting food, or hitting or screaming or things like that. And so we have to find ways to minimize negative reinforcement while trying to do more of the positive reinforcement for some different type of behavior. And that'll become more clear in the next couple slides. So most behaviors start with a limit being set. And by setting a limit, I mean basically putting a demand on a kid. And so it's anything from time for bed, time to eat, put on your shoes, hang up your coat, clean up your room, brush your teeth. Anything that we're putting a demand on can elicit some of these challenging behaviors. And so this is some advice on how to set limits from a behavioral psychology standpoint, especially in younger populations and populations who might not be able to do multiple step directions or really complex directions. You've got to really be careful of keeping commands simple and short and to the point. You don't need to explain it, and you don't need to go into a lot of detail. It can just be as simple as, it's time to hang up your coat, not it's time to hang up your coat because daddy's tired because I worked all day and because I'm tired of cleaning up after you. Okay, that's too many words and they've lost you. And then you have to make sure that you're realistic, and you have to use clear and affirmative commands. One of the biggest challenges that I think parents have is doing a lot of stop this and stop that and don't do this, which is helpful to some degree, but it's not as helpful as telling them what they should be doing, because most kids and young adults with developmental disabilities, they need more help with what to do than what not to do. So giving a lot of opportunity to comply is also important. I had a parent in my office just the other day, and we were talking about behavioral compliance, and this kid was misbehaving a little in my office, and she was going, okay, stop it now. Okay, you need to do this. Okay, you need to do that. Okay, stop it. Okay, do this. And the kid was just like, whoa, 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 whoa. You just told me 6 things to do, and I'll back at number 1 so far. So she was really just not giving him an opportunity to even think through what she was asking him to do and comply. So I had her just sort of slow down and give him one suggestion at a time. Warnings and reminders are actually helpful, but you have to be really clear with it. You can't do the parent thing of, and I'm guilty of this too, if you don't do this, then something major will happen, but I'm not prepared to follow through with that. So I literally had this happen one time in my office, that there was a family who was going to Disney World, and I had a mom in my office say, if you don't do this, we're not going to Disney World. And I looked at her and I said, did you buy non-refundable plane tickets? And she was like, yeah. And I was like, are you really not going to go to Disney World? And she was like, oh no, we're going to Disney World, but I just want him to think we're not going to Disney World. And I'm like, he's going to call your bluff, and then you're going to be the one who's, losing your credibility when you're making threats like that. So you have to think through, if you're going to give a warning, like, I'm going to count down from 3, and then we're going to have to leave the store, or we're going to have to go home, or we're going to miss out on that birthday party. You got to be willing to follow through with that for your own credibility. Instead of threatening, use when, then, or if, then commands. When you do this, then you can have this, or then we will go to this place, or whatever. Or the if, then. If you can calm your body down, then I will give you the blanket, or then I will let you into my lap, or something like that. So you're giving them a really simple one-to-one contingency of, here's my expectation, here's what I'm looking for, and notice that it's both in the positive direction. And then if you can give options, but only 2 to 3 maximum. There's something called decision paralysis that is a real construct where if you give too many options to someone, it makes the decision actually much more difficult. It's kind of the idea of going to the all-you-can-eat buffet and they have 50 things and someone asks you what you want to eat and you're like, I have no idea, versus just having 2 or 3 things to choose from makes it a lot easier. All right? So, whether you know it or not, you all have a superpower, and your superpower not only is parenting and having patience to work with difficult kids, but you have a special power of attention, because what children want more than anything is not just attention, they want positive attention, but they'll take any kind of attention. It's a hierarchy. I want your positive attention, but your negative attention is better than no attention, if that makes sense. So I have a lot of people who come in and say, well, they're just attention seeking, they're just attention seeking. Well, they're attention seeking only in the instance that they don't really know how to get your positive attention, so they'll just shoot for your negative attention, and they'll be okay with that, okay? So what we want is to try and make sure that we're spotlighting or shining our attention on the positive behaviors, the things that we want to continue, even if it's really small. Even if only 1 out of 10 times they're doing the thing that you would like them to do, make a big deal out of that. Jump up and down, celebrate, praise them directly for it, and put a name to what they've done. So put into a simple graphic about behavior change, ignoring, so refusing to give your attention, plus reinforcing a positive behavior or something to replace that bad behavior, equals something called extinction. Extinction is the holy grail of behavioral psychology. It's the idea that a maladaptive or really challenging behavior not only decreases, but actually goes away and doesn't come back again. And that's what we're all looking for here, is not constantly having to work on these behaviors over time. We're just looking for them to be replaced by something that's more functional, okay? So these are not easy things to do. This is not a natural way of parenting. I don't parent this way most of the time, even though I talk about this stuff ad nauseum every day. But if there is a target behavior that you can identify, this is the formula for getting it to change over time. And so ignoring really truly means ignoring. Sometimes I even have parents turn away and face the other direction or get on their phone while the child is misbehaving or doing something that they shouldn't be doing. And it's the most concrete form of ignoring that you can have. But then let's say after about 5 minutes of refusal and acting up, they do the thing that you've wanted them to do in the first place. The phone immediately goes away, you turn around, you make eye contact, you praise them for doing the behavior, you tell them why it's important that they do the behavior, and you give them a big hug. And over time, that contrast makes a big difference, even to the most stubborn patients out there, even to the children who have some challenges with learning complex behaviors. It's just a matter of how often you have to repeat it to make it sink in. So this is a funny example. Hopefully, let's see if can you click on it in the back and get this video to play? Can you click on the link and see if that works instead? All right, so there's a kid playing alone in the living room while his parents make dinner. His dad hears him throwing toys. When dad comes in to take the toys away, starts a temper tantrum. Dad doesn't usually pay attention to the temper tantrums, but this time he gets a really good video, and I hope we can get it up because this is hilarious and illustrates my point. Come on, technology. Don't fail me now. Loading. We get to watch a U.S. Army recruitment video first. That's good. That's good. The Army is good. It's great. Dad went around the corner and he couldn't see him anymore, so he stopped the tantrum. All right. Thanks, you can stop it now. So I love that video because it so perfectly illustrates what we're talking about. It's not like the parents are going, buddy, I love your tantrum, thanks so much for that. But when they're going for any type of attention, they'll take your frustration and they will feed that into the fire that is their challenging behavior, and it's enough for them to keep going with that behavior over time. But positive attention is like jet fuel. So if you give them positive attention for positive behaviors, that will definitely outweigh the negative attention that they're getting for their negative behaviors, if that makes sense. All right, so planned ignoring. It's hard. I acknowledge that. I empathize. I've been there. I have a 3 and a 7-year-old. And so I spend a lot of time talking about this with parents all the time and talking about how to pull it off. Planned ignoring means you're acting like nothing is happening. You're not commenting it. You're not saying, I'm ignoring you. You are literally just ignoring them. And you don't talk with them about it. You give them minimal visual attention. I usually say make sure you can see them out of the corner of their eye for safety reasons. But you have a poker face, and you keep the tone of your voice neutral. So that's one of the hardest parts, is not to grit your teeth. I've gotten really good at this just as my professional life. I'm not as good at it in my personal life with my own children, but as an example, so let's think about tantrums to run through this whole sort of scenario, right? You set a limit. You're in the grocery store. He wants mom's phone. Mom says no. Tantrum, crying, screaming, flailing around. So then mom tries to wait a while and talk him out of it, but gets embarrassed because they're getting looks, and so gives the phone after a while, okay? That's a common scenario. There's no shame in that. I have absolutely done worse in my own parenting than that. And so the problem here is inadvertent reinforcement, right? We're giving some positive reinforcement for a behavior that we don't want to avoid some social embarrassment. So I talk through all the time these two options. Leave the store. Well, I have a cart full of stuff. Yeah, it'll get put back. They have people for that. They get paid. It's fine. Just leave. Or you can do a timeout in the car. That's one that I didn't put up on here. Cars are a great place to do timeouts. You put them in the car seat. They can't go anywhere. You shut the door. You turn around. You play on your phone and listen to some music or something outside while they're screaming in the car. That's the best ignoring on the planet. They can't do anything. They're totally safe, and you can barely hear them through the window of your car. So it works really good. I do that one. And then the other one is you continue to ignore them and either tip your cap or give a thumbs up to the people who are staring at you. Because if they know anything about parenting, then they would give you a thumbs up right back. And I go up to people in stores all the time, and their kids are having a tantrum and the parents are ignoring. I purposely will go up to them and I'll be like, "You are doing awesome. I am really impressed." And they're like, they look at me like I'm an idiot. And I'm like, "No, really, I'm a psychologist and a dad. You're doing fantastic. This is really impressive." And it's amazing how they stand up a little bit taller and they're like, "I am doing awesome. This is great. Now come out from under the clothes." All right, self-harm. Here's one that's a little bit more tricky and challenging. Um, so, child's dysregulated, doesn't have language to express themselves, has some extreme behaviors, things like that. So they start banging their head on the floor, the table, the wall, the chair, etc. I get this in feeding sessions or sometimes in my office. And then the response is usually parents are distressed and respond by trying to change the expectation, remove the situation, or attend a lot to that behavior. Totally reasonable. I absolutely get why that's the response. But you're getting a little bit of negative reinforcement in there, and that's likely to continue the self-injurious behavior over time. And what I have learned over the years and what a lot of my colleagues do is one of the following things, or all of the following things. Most of that is superficial. There are very, very few kids out there who will actually hurt themselves. I've gotten confirmation from this from child abuse specialists who look at injuries and things like that. I've gotten confirmation from other medical providers who work with these types of kids. Even the ones who look like they're banging their head pretty hard, one of the hardest bones in your body is right there. It is incredibly hard, and you have to do a lot of damage to actually crack your head this way. And so the kids who are on the floor, hitting their forehead on the floor, are usually at most giving themselves no more of a bruise than a 3-year-old gets falling down learning to walk all the time. And we don't prevent them from doing that. So some of the time, you can just ignore it. Hand to head hitting, if you tried to punch yourself hard enough to hurt yourself, well, I encourage you to try it sometime. It is very hard to do. You can't get a lot of leverage going like this, even as an adult. So I've met very few kids who I think could actually hurt themselves by hitting themselves. Or you can place a pillow or a hand between the head and their surface and continue to ignore. I demonstrated this with one of the more severe kids by, I would just put my hand next to the wall where they were banging their head on the wall, and then I just turned away and held a conversation with mom and dad about why we weren't attending to it. And the kid's head moved, and I went like this up and down the wall because they didn't want to do it on my hand because my hand is soft. And so it wasn't giving the desired effect, and no one was paying attention. So they kept moving around trying to find a place on the wall. Or you can do it with a little pillow or a stuffed animal. But it was amazing how this 8-year-old who had been doing that all their life stopped within about a week and a half of that plan being implemented. And then make sure that, as with anything, praise them when they stop and cue them to do so. Hey buddy, when you stop, then we can move on and do something else. That's all you need to talk about. Or you can give them another option. So give them something to hug really hard. Give them something to chew on if they're a biter. Find an alternative for them to get some of that anxiety or frustration out instead of doing the self-injurious behavior, but then praise them when they do it. Hey, I saw you were chewing on your chewy tube. That's fantastic. Great job when you were upset today. Okay? Do you have a comment? Yeah? Okay. Well, you can ask me your question later, okay? So, there are some times when you shouldn't ignore. I get that. If they have dangerous or destructive behavior, if the aggressive behavior is beyond superficial, if they're drawing blood or if they're causing damage to themselves, then you absolutely need to intervene. Being aggressive towards someone else that's beyond superficial, and failure to follow crucial instructions. I always hesitate to put this one up there because crucial to me means something that would risk their health, such as not walking out in the street or not jumping off of a really high thing at the playground, right? an important request isn't, I want you to wear jeans today and you want to wear something else today. That's not that important in the grand scheme of life, even though sometimes it feels like that. So in those cases, you shouldn't ignore. And what we often do is some form of timeout, okay? This works for almost every population of kids, young adults with special needs, all of that. You might have to do some modifications, but find a good pediatric or behavioral psychologist and they will be able to help you with that. So, goals of a timeout. It is not a punishment. It is not meant to make them upset. It is meant to give them space to learn better self-regulation and remove them from the stressful situation. So you want to provide them space and time. You want to model those appropriate ways to manage negative emotions. So you can't just sit them off in the corner and say, deal with it. You have to teach them the strategies you want them to engage in. Let's take some deep breaths together. Let's sit with our body relaxed for a little while. Let's lay down flat on a pillow. Let's hug our blanket really tight when we feel frustrated. All of those kind of things. And then again, I'll repeat it a bunch of times. Praise them if you see them doing that. That's worthy of praise. And then try and change the situation. So you shouldn't have them, if they're stressed out about where they are, don't make them sit where they are in a timeout. Move them to a different location, a different space, a different setting to do the timeout. And a timeout can also give you as a parent time to plan and decompress. Because what we all know and what we can admit to ourselves is that if we dole out consequences while we're upset, they tend to be unreasonable and they tend not to work very well, and it tends to just exacerbate the situation. If I take 5 minutes to sit and take some deep breaths myself, I'm usually more reasonable and I can come up with a better strategy for what kind of way to move forward that there would be, okay? Timeouts are not administered out of anger. So you shouldn't wait until you get to the point of being really angry and then say, all right, time out, and you're dragging them off to the corner, because that's probably a behavior that you should have been ignoring. If it's okay enough to happen for a while until you're angry, then it's okay to continue happening and for you to figure out a different way to manage it. So choose a good location, choose it ahead of time. If you're on the go, if you're somewhere that you aren't normally, then you might have to think quick and figure out what the closest place is. Like I said, cars, man. Your Thanksgiving at the in-laws, your car's probably outside. You're at the mall, your car's probably outside, and that's a really safe place to be. I hear psychologists saying sometimes, like, you shouldn't make them do a timeout in a place that they have to sit normally. Like, I definitely don't do in the crib timeouts because they do have to sleep in there. But a car seat is just a car seat, and a car is just a car. So I've never had any issues with doing car timeouts. Choose an appropriate behavior. Make it a learning experience for your child. Even if you have to do the same learning experience 50 times, make it consistent. So if they're exhibiting a similar behavior over and over again, be a broken record about what to do different next time. How can I help you do it different next time? Or here's how I'm going to help you do it different next time. And then when they're done with the timeout, practice it. Even if they're calm by that point, it's still okay to practice. Okay, next time you feel like that, what can we do? We've described these 2 ways. You get your favorite blanket or your favorite toy or something that's handy, and you give it a hug or a squeeze. Or you stomp your feet 3 times and count to 10 or something like that. I have a feeling I'm going to be on Facebook later, but that's fine. That's why I dressed nice today. So you choose a good duration of time. 5 minutes is the max, no matter the age. I've heard like the age +2, that only works up to like age 3. So normally I say either like 2, 3, or 5 minutes are the ones that I've done. And I started doing timeouts with my kids, and I start recommending them when they're developmentally about 18 months old. So take that into consideration when you're thinking about where your own child/children are at this point. As soon as they can understand true cause and effect, that's when timeouts are okay. Does that sound fair to you? Okay, good. Just checking. You can provide a warning if appropriate. So if it's something like they're walking out into traffic, you don't want to wait until they're in traffic and give them a warning before you're doing something about it. Or if they're doing something that causes some real physical damage to someone, you can't just sit back and watch. But in a lot of circumstances, you can give them a quick warning and give them a chance to calm themselves down. And then, of course, if they ever do, what would you do? Praise them, right? They could be misbehaving and being so naughty, and if you give them one warning and say, if you can't stop that, I'm going to have you go into a timeout, and they stop it, that's the best. You praise them for that. You've avoided a timeout, and they've learned something. They've learned how to control a behavior that might not have been controllable before. So that is a chance to really praise them and tell them why you're so impressed by that, rather than just, yeah, you should stop doing that, and then walk away. That doesn't really give them incentive to keep working so hard. Make sure you set a timer. Some kids can do this, requiring a couple minutes of silence before the timeout's over. If they're just screaming for the sake of screaming, and you know that they have the capacity to be quiet, then you can often do that. Some kids just really can't, and you just give them the time and then help them calm down. If they come out early, calmly return them, reset the timer. It's pretty simple. And then once the timeout's complete, be positive and break that cycle. This isn't the time to sit down and give them a lecture about why they're so naughty. This is a chance to start encouraging them to do something different, starting this moment forward, okay? Glad we both had time to calm down. Now here's what we're gonna do next. All right, when you're doing any behavioral intervention, behaviors are gonna worsen. Just a fact. Talk about behavior extinction bursts here in a second. Don't give up on it. Don't do it 5 times and then decide, oh, this just isn't for me. This just doesn't work for my kid. That's not how long it takes. It takes a long time. You're gonna get better at it, and they're gonna get better at it. Don't become a timeout junkie. I know way too many parents who, when I ask them, I describe all this and we talk about timeouts, and they come back 3 weeks later and they're like, I got this timeout thing down. They're getting like 6 or 7 a day. It's working really great. It's like, no, that's not really what we're shooting for. We're probably starting with a behavior that might be a little bit more frequent than what we can work on right now. We might need to start a little bit smaller with our expectations here. And, you know, give them the 3 strikes and you're out rule, give them the count to 3 rule. But like I said before about Disney World, you can't count to 3 and then let it keep going and walk away and say, oh, well, never mind. You have to follow through if you're going to do one of those methods. And then use the if-then statements. If you can't do this, then we will do this, okay? Okay. Making a behavior plan that works. Now, when you're trying to change behavior and teach positive things, you have to have a strategy. What are we trying to get them to learn? How are we going to do it? What if they're with dad and not mom sometimes, and mom and not dad sometimes, and then grandma comes over and takes care of them, and then they go to school or a babysitter? Everybody has to be on the same page, because especially for kids who need a lot of repetition and concrete learning styles, they are not going to benefit very well from mom does it one way and dad does it one way and the babysitter does it a third way. They need it to be consistent. So immediate rewards are usually really most important. The closer in time you can have a positive behavior to a reward, the more likely they are to associate those 2 things in their mind. And that's what you want. You want that conditioning that we talked about in the beginning of, I did something good happened, I did it again, something good happened again. I could get used to this. I could get used to this positive vibe that I've got going on. And so if they receive a reward, they must earn it. And if they don't earn it, they can't receive it. So you can't say screen time is contingent on your behavior for this example, except when I'm tired or except when this circumstance comes up. If that's your criteria, that's got to be the criteria. Because again, it's got to be foolproof. And then a token economy, that's also called a sticker chart. Just a couple words about that. Make it specific and concrete. There's no tricks to it. 1 sticker equals a point or equals access to something, and you can have a menu of rewards if you want. Watch a show, play on mom's phone for 5 minutes, read an extra book with dad before bed, get to choose dessert tonight, whatever you want to do, and they earn points towards that for positive behaviors. And then you can make it more difficult over time to earn. Just because you start off with a basic behavior doesn't mean it can't get more and more complex as they improve. So I like to put this up just because this is like this mom was so turbo about the behavior plan, but it worked really well. That's like a science fair sized poster, like this tall, that she would haul into my office every time. She would set it up on my floor, and she would have her son describe, like, so how'd you do this week, buddy? And he would be able to go through and he would be able to say, this is what I earned this week, this is what happened. And so you can see on here, these are different, this is his menu and how many stars it takes to earn things. And then these are the things he wanted to earn over here. And then this is what the expectations were and how many times he did it in a week. So that's just one example, but visual aids are really, really great. It helps parents and kids understand how close am I to earning something, what's expected of me, when did I achieve the goal and when did I not. And you can tailor it to whatever developmental stage your child is at. The other thing I like is coins. Kids love having little like plastic coins or something like that. You get them on Oriental Trading or at the dollar store, and you let them put them in a bucket every time they do a behavior that you want them to do again, and you either count those up at the end of the day or they have to earn a certain number to get a reward or something. That's a great thing. Okay, so let's talk about some more special populations and behaviors. Who here has heard of applied behavior analysis? Okay, good. Applied behavior analysis is just an adaptation of what we were talking about today. So it uses a functional behavior analysis to help understand and modify behavior, but what it does is you are constantly doing these functional behavioral analyses with the help mostly of a really expert treatment team. You can actually get a whole degree and certification in applied behavior analysis. So it's not a simple thing to do, even though these are relatively simple concepts to understand, because it uses discrete trial training. Discrete trial training means something, we're taking little tiny snippets in time and trying to move someone forward on a skill or behavior. This is most commonly developed for and researched in the autism population, but it works really well across the spectrum of children and adults with cognitive impairments. And so it's very time intensive and effort intensive. So I would suggest getting some professionals involved if you feel like your child might need something like this. But it focuses on extinguishing specific target behaviors through training and acceptable alternatives. So in general, that's what we're trying to do with any behavior therapy, but this is like very, very specific, very, very repetitive, and long-term. So an ABA team might be, I have a couple patients where the ABA team is in their house for 12 hours a week, every week for 2 years, trying to make behavioral changes and learn functional skills. But the idea is that you're going to take a chunk of time. Let's say you devote the next hour to trying to get your child to put their shoes on independently or say a word when they want something. You are going to spend that hour only focused on that behavior and nothing else, and ignoring anything else that's happening and really purposefully reinforcing whenever they show a glimmer of that behavior. So if you have a nonverbal child and you're trying to get them to say please for the first time, then you might just acknowledge any sort of verbalization or any approximation of the sign for please, right? But over time, you're only going to reinforce when they take a little step forward. So then you might only do like when they really do the right hand sign language, or when they start a utterance with like a p sound. And so you reinforce that. And then the next step would be whatever, okay? And so they've shown that people can learn really complicated behaviors using this methodology if you can put the time in and the expertise in and you come up with a good plan. So it can help extinguish really challenging behaviors too by training better coping strategies or something like that. And honestly, for most kids in the developmentally challenged population, communication is a huge factor in behavior, because the older you get and you can't communicate, the more your behavior has to act out what you're thinking and feeling. And for a population or for a kid who gets frustrated easily, they're liable to act out easily and not have good self-control. And so the more you can teach them to communicate, whether through gestures or hand signs, like I had a kid who I taught to give like the thumbs up, the thumbs down, and the neutral sign. And that actually helped parents take their temperature of like how things are going right now, and it helped reduce some of the behaviors they were having. And then I also wanted to talk here towards the end about finding a local provider, because not every psychologist is the best, and not every person is trained to deal with these types of challenges that you all are facing. And so you do really want to be careful about who you're going to and what their qualifications are. And as a psychologist myself, all of these questions are perfectly fine to ask over the phone before you agree to see somebody. There's no offense to those. And if they can't answer them or feel uncomfortable about them, probably don't want to go. And they probably don't have a good answer because they don't know. So you can search your insurance website for providers. That's one way to get a general sense of who's out there. And there are usually like a couple practices in your area that might have a lot of psychologists there. That usually means that they use some evidence-based techniques and that they've been pretty successful, or else they wouldn't keep hiring people. Psychologytoday.com, you can go and search for free. You can put in what your insurance is. You can put in what services you're looking for, what age your child is, and you can find providers who supposedly specialize in those things. But then when you get on the phone, ask these questions. What type of therapy do you use? What experience do you have with kids with developmental or cognitive impairments? They should be able to say that. What's your plan for working on whatever the challenge is with my child? And do you accept my insurance? And how will I or other caregivers, my spouse, grandparents, whatever, how will we be involved in the sessions and in the treatment? You want to look for someone doing behavioral or cognitive behavioral therapy, although you can ask if they say, well, I use ABA techniques or I use, other things like that. You can say, is that a kind of behavioral therapy or is that a kind of cognitive behavioral therapy? Because there's different permutations in what we call it. They should be able to clearly articulate how they work with kids who have similar challenges. If they say, oh, well, this would be an adventure for both of us. Well, that's not what I want to hear. This is an adventure for me. I want you to be the one who's steering the ship. That's not what I'm paying you for. And then be wary of anybody who's not focused on parent education. Because for these type of challenges, this is not a play therapy situation here, okay? So if you have a therapist who says, yeah, I would just really want to get to know them and take them back with me and we'd do some art and we'd get to know each other really well and you'd stay out in the waiting room, that's a red flag for this type of situation, okay? Other helpful professions to ask about. Many of you may know of these. I wanted to put it up here just in case, but psychology is only a small part of what can be really helpful for behavior change and help for really complicated populations of kids. So I have a real luxury of being able to work really with all of these people at my institution at Nationwide Children's. I've learned so much from every one of these disciplines that helps me to know when it's time to seek out some other help or some advice that they would have to give. But developmental behavioral pediatrics, I'm a huge believer in that profession. They're specially trained physicians who specialize in the crossover between psychiatric and medical conditions. So they work a lot with kids on the autism spectrum and developmental disabilities, but also chronic medical conditions that might impact behavior and things like that. And they tend to prescribe medications more in line with what a psychiatrist might be comfortable with, but they also can come at it from what if I have a complicated digestive tract issue? What if I have a really interesting set of medical situations like heart conditions or something like that that we're struggling with? A developmental behavioral pediatrician will be well versed in that. And there's actually a national society for developmental behavioral pediatrics that you can look up online to find providers. Child psychiatry, of course, can be helpful, and I've already gotten from a few of you today some questions of medication. Parents feel differently about medication. Some parents are great with it, other parents are not great with it, and everywhere in between. Medication sometimes can be a really helpful tool to help lower the threshold of when an explosion happens so that they can be more receptive to the behavioral therapy that we're trying, and then they can be either weaned off of the medication or they can continue on a lower dose in the future. But also, if you have an intellectual and developmental disabilities center around, that's where you might look for autism centers as a way of searching, because usually what an autism center has is people who are well versed in assessment, treatment, and understanding the complications of a child with a developmental and cognitive impairment. So we have a place called the Child Development Center at Nationwide Children's, for instance, and it's a whole nother team of folks in a separate building, and all they do all day is developmental evaluations for kids like yours. And they actually employ all of these disciplines within the same building. Most or many children's hospitals these days have either a team or a center, or this might be something worthwhile to make a 2 or 3 hour drive every 6 months to go consult with a group like this. And then the last is, I'm sure many of you are connected, but I'm always shocked with how many people slip through the cracks of their local board of developmental disabilities. That is your gatekeeper to all kinds of services for lifelong support for your child. So you want to get them in early. People sometimes think of this as an adult service, but this is also how you can get access to special education programs, to assessment services, special training. They usually have a good finger on the pulse of providers and services in your area. So just make sure you're looking into that as early as possible. And then I think this is my last slide before we just start talking turkey about your own kids. But resources for parents. These are all really great books. I'll be honest, none of these are going to be like in-depth about kids with really significant disabilities and things like that. There are a few books out there like that. They're usually like a few $100s because they're meant more for providers than parents. But these are the ones that I think have a lot of the underlying mentality and strategies that you might benefit from learning. They're all really digestible. I recommend that top book, The Everyday Parenting Toolkit. I recommend that to everybody no matter what. So even if you have perfect angels, that's really helpful for just learning how to have some different strategies in your pocket. The bottom one, Understanding Applied Behavior Analysis, that one, of course, is specific to the more behavior analytical things that we talked about for things like autism spectrum disorder and things like that, and that's a great book too. So you can get all these on Amazon, and I think the most expensive one is probably $20. So they're really good. All right. So, and then last, I appreciate it. So these are my two little monsters, and just to let you know what I'm working with, his name is not really Dennis, but that's Dennis the Menace. So his teachers actually call him that now at preschool. And then that's my daughter. We call her Next Level because every time something's going well, she takes it to the next level and makes it not go well anymore. So those are my two precious little angels. So I am open for questions, comments, thoughts. Thank you.
Thank you very much for doing this.